Hi, thank you for joining me here today. I'm Yunmi, and I'm here today to talk to you about the impact of American Recovery and Reimbursement Act on privacy. In 2009, ARRA enacted into law. ARRA has provided significant changes to the Health Insurance Portability and Accountability Act, HIPAA privacy rules. This presentation overall aims to discuss what ARRA changes in privacy rules and role of health information management professionals. I'm going to discuss about what ARRA is. Some points I will mention are changes ARRA made on privacy rules, such as business associate, restrictions on disclosure, breach notification, marketing and fundraising, sale of medical records and minimum necessary, improved enforcement, and lastly, I will discuss the changes to HIM professionals' role. In 2009, the American Recovery and Reimbursement Act enacted into law. ARRA is considered one of the major health information technology laws and has provided significant changes to the HIPAA privacy rule. A substantial portion of the bill, HITECH, which the Health Information Technology for Economic and Clinical Health Act, provided funds for the implementation of electronic health record. EHR had widespread use, but traditional HIPAA has some limitations to protect the confidentiality and security of EHR. So ARRA developed standards for the exchange of health information and strengthens federal privacy and security standards. Here are some changes. First, ARRA includes any business associates to patient safety organizations that should follow HIPAA privacy rules. A covered entity is a person or organization that must comply with HIPAA privacy rule. There are three types of covered entities: health plans, healthcare clearinghouses, and healthcare providers who transmit any health information in electronic form. Business associate is a person or organization other than a member of a covered entity's workforce that performs the use or disclosure of protected health information. It means health professionals also need to comply with the HIPAA privacy rule. Secondly, ARRA extends the consumer's right to request restrictions on disclosure of information regarding a specific healthcare items or services. Under HIPAA regulations, individuals have the right to request restrictions on certain uses and disclosures of their protected health information. However, the healthcare providers or insurance was not required to agree to the restrictions. Now ARRA extends the consumer's right to request restrictions on disclosure of information, so patients can keep their particular health procedures for privacy, such as contraceptive cares or mental health services. Next, I will talk about breach notifications. HIPAA did not require the covered entities to notify individuals of breaches of their protected health information, but ARRA demands covered entities provide notifications to individuals if their health information has been breached. ARRA provides some definitions of actual notification methods required. For example, if the breach affects more than 10 individuals, the covered entity must be notified about the breaches individually or publicly on the website. If more than 500 individuals are affected, the covered entity must immediately inform the Department of Health and Human Services. Regarding marketing and fundraising, before ARRA, covered entities have been able to use an individual's demographic information and the data that any healthcare was provided to send fundraising communications to the individuals without obtaining their authorizations. For example, without authorizations, drug companies and other entities conducted unlimited marketing of health-related items to patients. Also, hospitals and doctors may use the personal information they collect from patients to fundraising. However, ARRA prohibits certain written marketing communications and allows individuals to opt out of fundraising appeals. So covered entities have been required to obtain authorizations from an individual before using his or her protected health information for marketing purposes. For sale of medical records and minimum necessary. HIPAA did not forbid the sale of such information, but ARRA created an express prohibitions on the sale of electronic health record or protected health information without a valid authorization from the patients. ARRA also clarified a data holder's responsibilities in releasing requested data by guiding what constitutes the minimum necessary. ARRA required covered entities to limit the amount and type of information shared with providers. In addition, ARRA improved enforcement. ARRA provides that criminal civil fines and penalties can be enforced against individuals as well as covered entities who do not comply with the HIPAA regulations. For example, civil monetary penalties include fines from $100 per violation up to $1.5 million for a series of identical violations. Criminal penalties for wrongful disclosure include fines from $50,000 to $250,000 and up to 10 years of prison. Lastly, ARRA has provided significant changes to the role of HRM professionals too. With the instruction of the EHR, HRM professionals create, manage, search, retrieve, and manipulate functions of EHR. This change required HRM professionals to have skill set, experience, and knowledge about standards and regulations. HRM professionals design and oversees health information systems to ensure that they meet legal and ethical standards. HRM professionals not only play the role as steward of the patient record, but also of applicable laws and policies. To wrap up, ARRA was established in 2009 and provided changes to account for the limitations in HIPAA. ARRA made changes on HIPAA privacy rules, such as business associate, restrictions on disclosure, police notification, marketing and fundraising, sale of medical records and minimum necessary, improved enforcement, and HRM professionals' role. ARRA strengthens federal privacy and security standards. ARRA influenced HRM laws and skill sets. Thank you for listening to my presentation.